Hi, my name is Martin Daxel and I'm a consultant in acute medicine. This video will demonstrate the practical aspects of achieving vascular access. We will use a linear probe to do this. Our probe needs to be in a transverse plane with the marker dot towards the left-hand side of the operator. A chair for vascular access is very helpful to steady the hand and improve your hand-eye coordination. I'm starting in the antecubital fossa, and immediately we can see the brachial artery with two veins. You can see that the veins are more oval shaped and the arteries are more round. On compression, the veins disappear and the artery pulsates much more obvious. Next, I would add color flow to my ultrasound picture. In a perpendicular angle, not much color flow can be seen, in particular in our venous flow. On tilting our probe towards the heart, the arterial flow is getting much more obvious. And on squeezing the forearm muscles, you will be able to see flow in both veins. On assessment of the veins in our patients, there is an obvious superficial vein. If I cannot find an appropriate vein, I will move more medially and will look for the basilar vein. We now move to our vascular model to demonstrate vascular access techniques. And first of all, I want to find our vein, and there is a nice vein at 1.5 centimeter depths. I will then follow the vein to get an idea if it is straight and if it stays in the middle of my screen. There are now two methods I can use, either an out of plane or an in plane method. I will demonstrate the out of plane method first. And again, there are two methods we can use here. I will first of all demonstrate the equal distance method. So our vein is 1.5 centimeters deep. So I will go 1.5 centimeters away from my ultrasound probe, and in a 45-degree angle, I should just hit the vein below my ultrasound probe. You can see how the needle is indenting our vein here. Finally, I will just go through the wall of the vessel. And you can see my needle tip appearing in the lumen. The second out of plane method is the so-called follow the needle tip method. The idea behind that my needle tip should be just at the level or slightly behind the ultrasound plane. So the ultrasound plane is always in front or at the needle tip. And I start with a tilting of my ultrasound probe towards my needle, and as soon as I can see my needle tip, I will tilt my probe a little bit away, move the needle tip in, a little bit away, and the needle tip further in. Let me demonstrate this in our vascular model. So I've got my ultrasound probe tilted towards me. I will insert my needle tip close to my ultrasound probe. And as soon as I see my needle tip on the screen, I will tilt my probe away, insert my needle tip a little bit further, tilt my probe away, insert a needle tip a little bit more, tilt my probe away, insert a needle tip further, tilt away, needle tip further in. I'm at the vessel wall now. Away, one more time, and I am in the blood vessel. The second method is the in-plane method for vascular access, and the ultrasound plane and the veins are fully aligned with each other. I will insert my needle close to the ultrasound probe, exactly in the middle of the probe, and I should be able to see my needle going under direct vision into the blood vessel. This concludes the vascular access video.